Welcome to familydoctor.expert. I'm Grant Blashki, and today we're going to talk about the exciting subject of marijuana. Now, I must admit, in presenting this one, I feel like, wow, I've really become a boring, conservative GP, like telling people to cross at the lights and brush your teeth. And as you'll hear, I'm concerned about marijuana use, and I don't think it's harmless, and we're going to have a little bit of a talk about that. So first of all, marijuana has lots of different names: hooch, cones, grass, hash, herbs, reefer, pot, ganja, mull, and I'm sure there's a whole lot of names that I don't know about. Comes in a few different forms. Marijuana can come as the leaves or the flower, what we call the heads. Often looks like a little bag of grass. There's also the hashish, which is the cannabis resin, and that's often more concentrated with the active ingredient THC. And then there's hash oil, which is more concentrated again, and often just a little bit put on the cigarette paper, and that's quite potent. The effects can be variable. People can get sleepy or they can get high. Some people feel relaxed. Some people feel disinhibited. It affects memory. It affects sense of time and space and perception. Increased appetite. People know about the issue of the munchies. You'll see a bunch of young people, usually at fast food outlets, late at night, seemingly having unending appetites. Increased talkativeness, changes to the eyes, bloodshot eyes in particular. Rapid heart rates in a lot of people can be an issue if people have got a history of heart disease. Detachment from reality, what we can call derealization, sort of almost as if you feel like you're watching a movie. And some people can have panic attacks and get quite anxious. So a whole range of sort of reactions. The active ingredient, as I mentioned, is called THC, and it's inhaled usually, although some people eat it, but usually it's inhaled in the smoke, gets into your bloodstream, rapidly has an effect, a high, somewhere between sort of 2 and 5 hours or so. The THC affects the cannabinoid receptors, which are responsible for pleasure and memory and perception. So, why am I saying that it's a problem? It sounds like that's a lot of fun. And of course, throughout the ages, the whole culture of marijuana use as a cool and harmless thing to do is very strong. You just look at current movies at the moment, and it seems like the heroes are always stoned or talking about getting stoned for most of the movie. Well, here's the main problem in my mind, is the serious mental disorders that can result from marijuana use. And I don't only have to look at the research. Just in the last year, I've had 3 young people, otherwise well-functioning, have drug-induced psychoses. 2 of them came from a good home background. 1 of them came from quite a tough background. And just to give you a sense, psychosis is not fun. You have hallucinations. So that, for example, you'll see things that aren't there. They can be quite scary and you can't get rid of them. You can have delusions, believing you have some special powers or having some really strong irrational beliefs. You can have disorganized thinking. You can get paranoid very often. You can have anxiety, and you can get so confused and disorientated that you attempt suicide. So this is all pretty serious stuff. But how do we know if this is true? Maybe these are just unusual anecdotes. Maybe these people were at risk of schizophrenia and psychosis anyway. Well, they may well have been, but there's a number of studies, a particularly big one, what we call a prospective study. It means they look at people at the start and follow them. Now, they had 50,000 young recruits in this Swedish study who they followed for 15 years, and they found that the recruits who'd smoked marijuana before the age of 18 had 2.4 the time chance of getting a psychosis or schizophrenia. So let me just repeat that. It's more than doubling your chance of getting psychosis or schizophrenia if you smoke before you're 18. So one message from this, if you're really absolutely convinced that you want to smoke marijuana, try not to do it before you're 18. That's what I would recommend. The other group who definitely shouldn't smoke, if you've got a family history of schizophrenia or psychosis, or you've had a past history of psychosis, don't smoke. You're at very high risk. I would add to that, if you've had a history of anxiety or panic attacks or depression, not a good idea, leave it alone. Now, I need to say that, some of the people with anxiety problems that are undermanaged, they will use the marijuana in a sense of self-medicating. They're trying to calm themselves down in difficult situations, in social situations, or maybe they can't sleep. You'd be better off going to chat to your GP and get some more less destructive ways of trying to manage those issues. So I've talked to you a bit about the serious mental problems, and I think that that's probably the biggest issue. Having said that, there are serious physical effects as well. Increased rates of lung cancer, at least up there with cigarettes, so you don't get away from any of that, and some of the aerodigestive cancers as well also. Impaired libido, lowered sperm count. If you're pregnant, it can get through to the baby, so also not a good idea to be smoking. Then there's issues such as the social effects, and there's what's called the amotivation syndrome, or what I'd call the gunner syndrome. So these are the people who are gonna do that, I'm gonna do this, I'm gonna do that, but it never happens. And it affects relationships, and it affects work, and it's not a cost-free activity. Is it addictive? Well, if you know a few people who smoke and they say, oh no, but it's not addictive, they're kidding themselves, because we know this. People start smoking, they smoke for years. If they don't have it, they get withdrawals, they get craving, they get sweats, they can get anxiety, they can have sleep problems, nightmares. So clearly there's sort of an addictive component. And of course in Australia and in many countries around the world, marijuana is illegal. And so there's all the legal risks associated with that. Now, we need to just talk about some of the myths and some of the realities. There is some role for medicinal cannabis, and there are some studies showing that it may well be helpful for people with chronic pain or problems like fibromyalgia, neuropathic pain, pain related to spasticity. And I think in these contexts, if it's well managed, I think that's fine. Maybe it's not that harmful, maybe it's a great drug that we should be using more. I'm conservative, I don't actually think that's true, and my sense is this whole notion that it's harmless is what I would call, and I'm going to introduce a new little tool for these family doctor videos, made beautifully from some tongue depressors, the Blashki B, which means bullshit. Absolute bullshit that it's harmless, okay? There's no question with these big studies, including this big one in Sweden, which has since been replicated in France, it's been replicated in Germany, in New Zealand, that you increase your risk of psychosis, which is really not fun. So definitely qualify as a boring conservative GP at this point, but I really think it's worth leaving it alone. I would say that the two groups who should really leave it alone are people under 18 and people who've got any mental health history, particularly psychosis in themselves or the family. Okay, well, I will get off my high horse now, and thank you very much for watching familydoctor.expert.